In my previous lecture, I have discussed in details about the therapeutic actions of thiazolidinediones, also known as glitazones, the short form being TZD. The two important drugs that belong to this category are Rosiglitazone and Pioglitazone. In this lecture, I will be explaining some of the contraindications, precautions, other side effects, and some of the concerns associated with the use of these drugs. The first contraindication, these drugs are not used in the treatment of type 1 diabetes mellitus, that is insulin dependent, but these drugs are very useful in the management of type 2 diabetes mellitus, which is highly prevalent among obese individuals and is associated with insulin resistance in various target organs such as skeletal muscle, liver and adipose tissue. These drugs act by stimulating the PPR gamma receptor that is expressed in various target organs and helps in reducing the insulin resistance, improving the insulin sensitivity, enhance insulin action, the glucose uptake, utilization, metabolism is enhanced, and this helps in correcting carbohydrate and lipid metabolism. On the other hand, type 1 diabetes mellitus is a chronic condition with little or no insulin in the circulation. Therefore, these drugs are ineffective in the management of type 1 diabetes mellitus, which is insulin dependent, and since there is little or no insulin in the circulation, these drugs are ineffective. Secondly, these drugs are contraindicated in a patient with signs and symptoms of heart failure such as peripheral edema, weight gain, shortness of breath or dyspnea. Also, these drugs are not recommended in New York Heart Association class 2 or class 3 stage of heart failure. This is because of fluid retention which is caused by these drugs. Most studies suggest that these drugs act on kidney tubules, causing reabsorption of sodium and water and leading to fluid retention. The third contraindication, these drugs are avoided in active liver disease due to increased risk of hepatic injury. Also, these drugs are metabolized through hepatic cytochrome P4 and 50 enzymes. So, these drugs are dependent on the liver for metabolism, and therefore these drugs are not used or avoided in a patient with liver disease. Lastly, several studies have revealed that pioglitazone increases the risk of bladder cancer. Therefore, these drugs are avoided in a patient with history of bladder cancer. Now coming to some of the other side effects, there is 50% increased bone fracture risk in women, and this is due to decreased osteoblast formation. Fluid retention may present as mild anemia and peripheral edema. Weight gain can also occur with thiazolidinediones. This is partly due to fluid retention but may also result from activation of PPR gamma receptor in the adipose tissue, increasing the adipose tissue mass and leading to obesity. Lastly, I would like to mention the FDA warning and the safety concerns associated with the use of Rosiglitazone. Several previous clinical trials have revealed that Rosiglitazone is associated with increased risk of myocardial infarction. Consequently, FDA issued a black box warning for Rosiglitazone concerning its increased risk for ischemic cardiovascular events. So this resulted in FDA imposing restrictions on its prescribed use. So this happened in around 2010. Later, in 2013, the FDA reviewed newer evidence which suggested that the cardiovascular risk associated with Rosiglitazone was equivalent to that of some of the sulfonylureas. So FDA removed the black box warning for Rosiglitazone. In January 2024, Rosiglitazone became unavailable by the manufacturer, but the concerns regarding the adverse effects still remained and the use of Rosiglitazone declined. So currently these drugs have limited use in type 2 diabetes mellitus, and also there are safer alternatives, safer antidiabetic drugs, newer antidiabetic drugs such as DPP-4 inhibitors, SGLT2 inhibitors for the management of type 2 diabetes mellitus. So this was about some of the contraindications, precautions, concerns associated with the use of pioglitazone and rosiglitazone in type 2 diabetes mellitus. So thank you for watching. If you find this video useful, please like and subscribe to this channel.